Welcome to the committee, everybody. We'll call it to order. We have a quorum. We are going to be moving a bill out today, and we have some very important conversations. And welcome to the Human Services Reform Committee. And so I think we're going to we're getting into our regular work now. Thursday is going to be some bills and some conversation. Tuesday is going to be some bills and conversation. Week from Thursday, I think we're going to talk about the governor's budget. So we're moving along, and I'm excited to do that sort of normally. And I'm looking forward to when there's actually people in the room to talk to us about. So in the meantime, Senator Hoffman will be presenting Senate File 17, and he'll move that to get it in front of us. And there will be a vote today. And so when the vote time comes, Ms. Johnson, maybe you can explain to us how we're going to be doing our voting procedure at that time. That'd be appropriate. So Senator Hoffman, welcome to the committee. You're muted, John.
Sorry, I didn't have an education at Anoka High School, so
you can only wish.
Thank you, Mr. Chair and members. As we look at moving Senate File 17, it is an unfortunate reality that many years ago there was an individual that was at our METO, at a METO program in Cambridge, and absolutely the parents were wondering why they couldn't come visit him, why they kept coming for the days to visit, and they would say, nope, you can't visit. Your son violated our rules. And the more we dug into and looked at what was really happening there, a couple of things came to mind. Here's a young individual who lived with a developmental disability and was placed for support up there, but realized that in a 1-year period was restrained 300 and some odd times, and even to the point of a 5-point restraint. And one of his sins was he wanted a glass of milk at 8:05 p.m. and was told that, no, your program ends at 8 o'clock. You can't have any milk. And he perseverated on the fact that all he wanted was a glass of milk to go to bed. Those stories I just wanted to share with you, which led to a larger look at there was a lot of people that were mistreated. And when the settlement agreement that occurred between the state of Minnesota and the folks that were in the settlement accord, the class action, it was certified as a class action lawsuit, which at that point the Attorney General said, better to settle. And so they settled, and it was $3-some million of a settlement. And part of that was to set aside money into a trust. And if I use the word trust ambiguously, so be it. But that money was put into the court in order for then the court system to make sure that Minnesota was following all the guidelines they needed to do regarding the class settlement, which was to people with disabilities. And that money came directly from the Department of Human Services. Fast forward 10 years, federal Judge Donovan Frank issued a release that said Minnesota now has met up to its obligations of the Jensen Settlement Accord. Thereby, I'm going to write the check back to the Department of Human Services. Hence, he wrote the check, and it's Department of Human Services. But Minnesota has a loophole that says that money has to go to the general fund. Those of us that sat and know the history of Jensen, know the history of aversion and deprivation, said, well, if the judge took the money from the Department of Human Services, especially the division that oversees people with disabilities, it would be fitting to come full circle and go back and then used for innovative programs and innovative solutions in order to enhance the independence of people with disabilities. That was the thought behind Senate File 17, Mr. Chair. And as such, that is now in front of you. And so with that, I think we already moved to have that bill forwarded, but I'll sit back. Any questions or concerns or whatever? Thank you.
Well, I think this is a good time. There's an amendment coming to make this bill actually work, but this is a good time for members to ask questions more about the Jensen settlement. We're going to be hearing from Mr. Johnson at the department. And I think what we'll do whenever we get ready for that point, we'll just move the amendment to get it in front of us. We won't adopt it yet. We'll hear his testimony. But any questions for Senator Hoffman before Mr. Johnson comes? And then we'll take questions of Mr. Johnson as well. And I have no staff near me, so if you are hoping to say something or Seeing nobody jumping to do that, Mr. Johnson, welcome to the committee. Welcome to the Zoom world. You spend a lot of time in little boxes on TV sets, I think, these days. So nice to see you in a little box on a TV set. Thank you. Welcome to the committee.
Thank you, Mr. Chair. My name is Chuck Johnson. I serve as Deputy Commissioner at the Department of Human Services, and thanks for the opportunity to be here to talk a little bit about the Jensen settlement. As Senator Hoffman said, the Jensen settlement rose out of a lawsuit on the MITO program, which was a program up in Cambridge, Minnesota Extended Treatment Options. And a lot of credit here has to go to the Ombudsman for Mental Health and Developmental Disabilities, Roberta Opheim, and her crew, who wrote a report that really exposed what was going on at MITO, as Senator Hoffman had described, and brought those issues forward. The settlement was agreed to in 2011 on December 5th. And there are kind of three big chunks to this. And I want to just walk through a little bit so you understand the work that's been done that will be continuing as part of what we've done with the settlement. The first big chunk of work is really related to the sort of narrow issue of the lawsuit itself, the closure of MITO, the class members and services and monitoring that was done of the class members. So MITO was closed on June 30th of 2011. And in concert with that, we began under court jurisdiction to follow the 300 some individuals who were part of the class and track them and report to the court on what was going on with them and assuring that they were living in the community and that they were being given the opportunities they deserve. As of June 30th of 2020, there were 302 still living from that class, 275 of whom were known to be in Minnesota. And almost 90% of them were living in community-based settings, either in adult foster care or in their own home or home of a family member. The other piece that this part of the settlement did was that the department developed alternative placements and services to meet the needs of the population that had been served in MITO. MITO served a population of individuals with developmental disabilities who have often somewhat extreme behavioral challenges and are more difficult to care for in the more typical adult foster care. As part of the settlement agreement, we created 3 homes we called Minnesota LifeBridge homes, one in Cambridge, one in Isanti, and one in Farmington. These are essentially specialized homes to serve that same population and to provide special staff and conditions under which we can care for those individuals, but not doing it in an institutional setting like MITO was, but doing it instead in the community in a community-based home. The other piece that we created as part of the settlement agreement to also continue to serve this population was a community support services group. This is essentially a mobile behavior support services that go and provide support to providers and to individuals who are living in the community who have behavioral challenges. And they're a group that's expert in person-centered services and positive support practices, and ensures that we can help these individuals stay living in the community and stay living in an integrated setting. So that's the kind of the first big part of the Jensen settlement. The other 2 pieces were actually broader about really looking at reform of disability services writ large and not just focused on the narrow issues of the class members themselves. The first of these was the positive support rule. This was an administrative rule that replaced the old Rule 40, which was the rule that had governed disability services for decades, and particularly governed use of seclusion and restraint procedures for people with disabilities. The positive support rule was effective August 31st of 2015. This really represented a fundamental change in disability services, a cultural shift to focus on developing individual strengths rather than trying to manage their challenges. Since that time, the department has provided training and technical assistance to providers and lead agencies in person through regular webinars, online trainings. We also have created in concert in partnership with the University of Minnesota, a College of Direct Supports, which does positive support training, 245D training, person-centered planning, civil rights, all of the kind of tools that providers and staff need to be able to deliver person-centered, positive support-centered services. This positive support rule also create an external program review committee This is monitor and provide guidance to teams working with people who exhibit self-injurious behavior. It's overseeing a decrease in the number of mechanical restraints for people with developmental disabilities from an estimate of 400 in 2013 to just 11 today. So this represents a great change that's been made in really shifting our systems for individuals with disabilities. Finally, the third part of the settlement agreement focused on the Olmstead Plan. I think this is something that's more familiar, I think, to most folks within the disability world that came out of the Jensen settlement. The Olmstead Plan is really goals and strategies with state agencies working together to ensure that people have the right to make choices about where they live, where they work, where they attend classes, and to be part of the community. And this is really an ongoing process of developing and changing to a system that not only provides those choices, but makes those choices real, provides people with the information they need to make good choices, and actually ensures that the services are there to support and make those choices real for people. The Olmstead Plan has been carried out by an Olmstead subcabinet, which has 12 agencies currently participating on it across state government. It was first created by executive order by Governor Dayton and renewed by Governor Walz. A number of accomplishments coming out of the Olmstead subcabinet, a complete revamping of the way that we manage waiting lists for waivers to be more focused on priorities, highest priorities, and ensuring that we're moving funds where they're needed. Also, how we manage funds within waivers has been greatly reformed. We also eliminated the CADI waiting list. You guys had a hand in that by lifting the funding cap on CADI waivers. I believe it was in 2015. Also, a restructuring of how people are treated, behavioral management, and this is what I referenced before in terms of the decline in mechanical restraints. So we've had a great decline in mechanical restraints. This is also a process of incident reporting, where every time there's a use of restraint, mechanical or manual restraint, it's reported to the department. This allows us to monitor, but also to provide technical assistance in those providers who may be struggling to work with an individual and to find positive ways to work with that person. There's also been an additional 3,400 individuals receiving services from vocational rehab services, state services for the blind, certain of our Medicaid funded programs to support employment, as well as students in competitive integrated employment. Again, integrated employment being a key piece of what the Olmstead subcabinet is focused on. Accessibility improvements, again, on the sort of transportation side of this, over 1,100 curb ramps, 43 accessible pedestrian signals, as well as over 33 miles of sidewalks created in the last year. The most recent expert who was called in by the court to review the use of positive supports and restraints at AMRTC, our Anoka Hospital, as well as at the forensic program in St. Peter, determined, quote, the defendant's use of restrictive procedures at both forensics and AMRTC reflects current best practices. There is strong evidence that best practices are being followed at an extremely high level. Also, as I mentioned before, we've been working with the University of Minnesota, creating regional capacity and developing mentoring for positive behavior, again, trying to support the staff that work in this sector. Had great record numbers of people moving out of ICFDDs and nursing facilities. This is another item that Olmstead has tracked and focused on, trying to get as much as possible, giving people opportunities to live in the community. And also housing stabilization services, individualized home supports, MSA housing assistance, all pieces that, again, you all had a hand in helping to expand those options for independent living in the community for people with disabilities. The Olmstead Cabinet isn't stopping, though. They've just set 6 new goals and are continuing to work. The goals include examining the relationship between students with disabilities and involvement in the juvenile justice system, as well as a similar parallel goal focused on adults and their involvement, adults with disabilities and their involvement in the adult justice system. Implementing abuse and neglect prevention plan for people with disabilities. This is a plan that was created by the subcabinet in 2018, but has only been implemented in pieces. And the intent now is to really create a multi-year comprehensive plan for addressing abuse and neglect of people with disabilities. I know this is a high priority for Roberta Opheim and Dr. Wick, the head of the Governor's Disability Council as well. Examine data collection practices to ensure agencies are collecting data needed to identify and address disparities. This is important as we move forward with this work to ensure that services and choices of services and opportunities are reaching all people with disabilities. And then finally, a focus by the subcabinet going forward on creating housing options that are affordable, safe, accessible. Housing, as you know, remains one of the most challenging aspects of working with people with disabilities. As Senator Hoffman mentioned, the court lifted jurisdiction on September 4th of 2020. Judge Frank, who is overseeing the old Jensen settlement, issued an order that said DHS has substantially complied with all requirements of the Jensen settlement agreement, and the court's jurisdiction did end on October 25th of 2020. It is our intent, and Commissioner Harpstead said it at the time, that we will continue to work on the efforts that we put in place as part of the Jensen settlement. This includes continuing to support and monitor those individuals in the Jensen class, as well as continuing the operation of the Minnesota LifeBridge homes, community support services, and all those pieces that kind of go to support the positive support plan, the training, the use of the behavioral incident reporting forms and that whole process, technical assistance and mentoring. Those are just part of how we do business now and will continue going forward. And finally, as I just said, the Olmsted subcabinet is still going strong and plans to continue working on our Olmsted plan with the 6 new goals to continue to improve the system across Minnesota for people with disabilities. So that's just a brief update on what the Jensen settlement was, what was accomplished, and where we stand today. I'm happy to take any questions, Mr. Chair.
Well, thank you, Mr. Johnson. That was actually very succinct and deep and enlightening. So any questions for Mr. Johnson on this point, then we'll move into the amendment. Anybody? Okay, Senator Hoffman, do you want to move the amendment? Then I'm going to ask Mr. Albrecht to explain it for us.
Mr. Chair, I move the amendment. I think it's the A1. Is that correct?
A1.
A1. Thank you.
Senator Hoffman moves the A1. And just rather than even us try to explain it, Mr. Albrecht, would you please explain the basic idea was we're trying to capture the $600 and some thousand that are left over after the $3.5 million and divert it into some kind of innovative disability grants or some reform efforts within DHS to be spent in some yet undecided way. And so, Mr. Albrecht, you can maybe go beyond that, please, if you will.
Mr. Chair and members, the excuse me, the A1 amendment is substantially similar to the underlying bill. The primary thing that it does differently is create a contingency. So it says if the state receives the money, then the money will be appropriated. The effect of that is to, I guess, work around the parts of the laws and rules regarding how money is counted going into and out of the general fund. So effectively what the amendment does is create a resource to pay for the appropriation.
So Mr. Albrecht, I understood that if we did this before the forecast was cut off, the timing in February, whatever date that was, that there would be no impact on the general fund because the general fund wasn't expecting to get this rebate or refund or whatever the term would be. But it struck me that and I was in talking with the department, that this would drop to the bottom line because DHS cannot accept funds and hang on to them. And I was told, actually, Mr. Albrecht, this is in the form of actually a check, which is really interesting because it's going from the feds to us or something. But that's just a detail that doesn't matter. So can you explain to me, it seems like somebody was saying that, I would believe that if the fiscal note that says it's got no net impact, where we gain 600 and lose 600 or 613 or whatever it is a zero effect on the general fund. But that after the forecast takes hold, that would be truly coming out of the general fund as an expense. Am I wrong on that? Mr. Albrecht?
Mr. Chair, I don't think it was ever the case that the timing mattered all that much. What mattered is the mechanism. The mechanism being whether or not it was framed as a contingency rather than a transaction, so to speak.
Interesting.
A deposit of unrestricted money and then an appropriation is functionally the same as creating it as a contingency, but because of the way our rules are structured, framing it as a contingency changes the way it's counted. Still has the same effect on the general fund without respect to the timing.
Well, Mr. Albrecht, maybe Mr. Greenman wants to offer his thoughts. If we pass this right away, I'm not denying, you guys live in this world and you talk to each other and there's budgeting rules that are how we do it. But if we pass this, like if this could become law today, I understand this would have no effect on the general fund. But let's say we wait till March 15th to pass this. Can you tell me what would the effect? Would there still be no fiscal impact? Maybe I'll just ask Mr. Greenman to hop in on that one. Or Mr. Albrecht, if you want to comment on the way, you can.
Mr. Chair, I think it might be clearer with the underlying bill that there was no quote unquote cost to it if it were done before the forecast. But I don't think like once this bill got to the Finance Committee that it would be real clear to them that the underlying bill wouldn't have a cost.
Okay, well, Mr. Greenman, can you comment on that? So do you understand my question? So the process gets snagged up and we don't get this passed on March 15th. Is it still going to be without impact on the general fund with how this is written, or another way you could write it? Mr. Greenman.
Mr. Chair, I think that's a hard question to answer. I think if this, I think what makes this complicated is that it's retroactive to a date before the forecast comes out. I think that if you were to look at this on March 15th, without trying to sort of sound too much like I'm not answering the question, I think we'd have a hard time not finding a cost.
Yeah, thanks. And so that's what I can't imagine that you wouldn't. I mean, I'm trying to be fair to you and the budgeting rules. And although if this is a new way to make money fall out of the sky, I'm all for it. Mr. Greenman, do you know what the cutoff date for the forecast is this year or in February?
Mr. Chair, I'm not sure what date the forecast is being released on. I think typically it's early in March.
No, but I mean, maybe I wasn't clear. There's a date after which you don't consider any new math, like February 27th, whatever's in the account as of then, and your best estimate.
Oh.
And whenever if this money had been sent to you at some point, I believe it's going to be recognized in the forecast. And so, just curious what date that they could hold off on that pending us trying to pass a bill. But if we didn't get it done by a certain date, then they'll have to follow their budget rules. I'm just curious. Maybe you can get back to me if you don't know.
Okay, I think we'd probably have to get back to you on that.
But it'd be late February, certainly.
Mr. Chair, yes, that's true.
And you said the budget forecast is coming out March. Did you say a date?
Mr. Chair, I don't know the date yet. I don't think we've been
March.
told what the date is yet.
Okay, very good.
Thanks.
So I think time is still of the essence on this. Senator Hoffman and others. I've had good discussions with other senators and representatives. And I don't think this is an easy thing to accomplish, given both the speed and the fact that we don't usually pass budget bills early. But I think that it's really warranted, in particular, to continue the good work that was begun by the tragedy of the whole Mito Jensen circumstance. And, so anyway, so questions from members. And then we're going to get instructions about how to vote about in our committee. Senator Benson, I saw a hand. How about that?
Mr. Chair, I think you are setting good direction for MMB. This money was intended to help people with disabilities. You're not shifting this for some, random purpose at DHS. This is very much the intent of the original settlement money. And so however we can, because otherwise this is going to fall into the general fund and get spent on things that aren't about people with disabilities. So let's move this over however quickly we can do it. And hopefully the House will move along quickly as well.
Well, thank you. Other questions from members? Senator Wickland. Wow, little hands are popping right up here. I see your hand, Senator Wickland. Yeah. There you go.
Yeah, that's kind of a new.
I should get out more. This is exciting. So go ahead, Senator Wickland.
No, I just had a question about, so do you have the same bill introduced in the House? Is it moving forward? And I guess are the same things happening there so that they understand the sense of urgency of it?
Senator Wickland, we're working on it. I've been in communication with both chairs. They are interested. And it's a new idea over there entirely. We've been talking about it for a little while here. And so any discussions that people would like to have just in friendly ways, just say, hey, what about this? With their leadership cadre and the members of those, the two committees that, I guess this is Senator Schultz's jurisdiction, I believe. I think they kind of match ours, but I know that the members on the other committee would be interested as well. So I hope so. Hope we can get there. I don't see this. There's nothing partisan about it. It's just simply good work. So, Senator Wickland.
Yeah, just a question for Commissioner Johnson. I assume that we don't have very many cases where we have money coming back from a settlement like this. So this isn't something that we do often. I guess it's just, could you confirm that? And so doing, a special bill to take care of this is something that we would have to do if we want to make sure that the money passes through without any additional cost taken out of it.
Yeah, thanks, Mr. Johnson.
Yes, Mr. Chair, Senator Wickland, I don't recall having gotten a payment back from a court. Maybe we did in the Karstens lawsuit, I can't recall, but it is a relatively unusual thing to have happen. And I think the devil is in the details, as Mr. Albrecht and Mr. Greenman were discussing. It gets into the fiscal budgeting rules more than it does the worthiness of the intent of the bill.
Thank you, Senator Wickland. Oh, you're done. Okay. And Mr. Johnson, is the department in a position to comment? You like this idea? Are you officially neutral? Is it like something you'd rather not do? I'm hoping to say it's an amazing idea and you can't wait for it to pass. So without putting words in your mouth, Mr. Johnson, do you want to comment about that?
Mr. Chair, we're neutral on the bill. As I said, I think that we certainly understand the intent is to try to recapture dollars that were intended to go to improve service for people with disabilities and to keep it in that sector, and that certainly makes a lot of sense. I feel like we need to sort out these budget rules a little bit more to understand how this has to be structured in order to ensure that it doesn't get captured as and go back to the general fund. And I think I don't have the expertise on that, but I know Mr. Greenman and his team are working with Mr. Albrecht to try to figure that out.
Well, thanks. In my opinion, not that I'm a budget guy, although I sit in a chair talking about budgets, is that if we don't get this signed into law by the cutoff date of your budgeting exercises where you set a number, that it's going to be a bill that costs $613,000. Anyway, any other questions from members? Ms. Johnson, do you want to outline voting procedures? This is a good time for that, please.
Yes, Mr. Chair. So members, the A1 amendment is before us. Senator Hoffman made that motion. So when we vote on it, assuming that it'll be a voice vote, the way the process works is the chair, Senator Abeler, will take a moment and have members unmute their audio feed and turn on their video feed if it isn't already. And then when the chair calls for the votes, members are asked to give both a verbal and visual cue. So I, and then raise your hand, or some members have done that thumbs up. And the chair, as well as myself and Mr. Brennan, will keep an eye on members' feeds to see how everyone's voting. After the chair calls for the ayes and the nays, he'll announce the outcome of the vote and whether the motion passes or fails. I can go through division and roll call if we want, but I don't know.
Just do that now and then we're done.
Okay. So after the voice vote, a member may call for division, and similar to an in-person hearing, the chair will ask members to give a sign of how they voted, and then we'll count them. And then roll call, if it's requested, it will be very similar to an in-person hearing. Mr. Brennan will take the roll, and then after the roll's been taken, the chair can request Mr. Brennan to announce the vote total. Normally the chair would do that. And then after he announces the vote total, the chair should repeat it and then announce whether the motion passes or fails, just so that it's the chair announcing that, not just staff. And then the final bit, under Senate Rule 12.10, upon the request of 3 members, a roll call vote accompanies a committee report in the Senate Journal. So for that to happen, a member would make the request, and then we'll look for at least 2 other members to join in on a visual sign, so raising hands. That's very similar to how we would do it in an in-person hearing. If there are any questions, I can answer that. I hope that's very intuitive and straightforward.
Very good. And so if there's a division, people would be required to do a visual cue of some sort. So I would count noses, and maybe I would actually ask Mr. Brennan to help with that nose counting, just to be sure. So, and so maybe we would I don't know that we're gonna have a lot of that in this committee. I can imagine some committees there's gonna be quite a bit of that sort of thing. So, and I want people to feel free to vote how we're gonna vote on stuff, especially toward the end with the bill we're gonna send out of here. There could be some disagreements about how we're gonna balance our budget. So anyway, very good. Any questions about voting? Okay, Senator Hoffman renews his motion that the A1 amendment be adopted. All those in favor say aye. Aye.
Aye.
Aye.
All those opposed? All right, so there, I just banged the table. The A1 amendment is adopted. I think we're ready for final discussion. Other members, and I'll go to Senator Hoffman. No? Senator Hoffman, you get the last word, and then we'll vote to move your bill on.
Thank you, Mr. Chair. Thank you, members, for taking up the A1 amendment, and what a discussion it is. This is righting the wrong. I mean, this is something that, the state of Minnesota had to take from the Department of Human Services. They took the money from the Department of Human Services in order for the settlement. It only makes sense what we're doing. And so I thank you very much for your support and really setting a precedent. Senator Benson said it well. This should go to the people that it's intended to, and we're taking that first moment. So thank you, everybody, for this. Mr. Chair, I move Senate File 17.
Your motion. And just a final comment. I appreciate what I heard from Mr. Johnson about the efforts that have been undertaken since this whole Jensen thing. And sometimes out of tragedy, something good can happen, and you never want the tragedy to happen. But there is an array of things that are going on now that I think we can be proud of. And the final step in that would be to make some innovative efforts with this. And who knows, maybe some of the innovations that come out of this little pot of money might be some of the more remarkable ones altogether. So with that, Senator Hoffman renews his motion that Senate File 17 as amended be recommended to pass and be referred to the Committee on Finance. Everybody understand the motion? All in favor, say aye.
Aye.
Opposed? Okay, that's that method. the bill is passed, it's as amended and re-referred to the Committee on Finance. Thank you, Senator Hoffman. And so now we're going to move into some money discussions. And Mr. Greenman, you're going to, I think, take the lead on that. Is that right? And there's handouts on this.
Oh, Mr. Chair, is this the? I think I'm prepared to talk about funding that the state received as a result of the most recent federal legislation to provide relief for the COVID pandemic.
That's what it says on the menu. So please do that.
Okay. Mr. Chair, the legislation that passed Congress was the Consolidated Appropriations Act of 2021, signed into law by the President on December 27th. That included about $1.64 trillion to keep the federal government, to set basically the budget for the federal government for the remainder of federal fiscal year 21. It also included the Coronavirus Relief and Response and Relief Supplemental Appropriations Act, which provides funding, expands eligibility for existing programs, and establishes new programs to provide assistance to individuals and businesses in response to the coronavirus pandemic. The total amount of funding for that was around $868 billion. One of the things I would start by saying is it's not 100% clear to us yet what amounts of funding we're going to receive. We've gotten information from various what we consider to be trustworthy sources of organizations that watch what goes on at the federal government, at the federal level in Congress. We have not received notices of award yet, so we don't know. So these numbers are preliminary at this point. I would also say that there's likely to be, or potentially there's going to be additional funding coming to the state as a result of this legislation that we haven't been able to identify exactly how much Minnesota is going to receive, in addition to these amounts that you're seeing here. So the largest amount is the Child Care Development Block Grant, additional funding from Congress of about $137 million to the state of Minnesota. This table shows the amounts and also whether we need Legislative Advisory Commission authority to spend the money, or approval to spend the money, excuse me. In the case of the CCDBG dollars, we don't, because we have statutory authority already in law to receive and spend the money. We did receive about $1,072,000 from the Chaffey foster care program for successful transition to adulthood. This is something we do before. We also need LAC authority for about $2.766 million we received for congregate meals and home delivered meals. We received about $23.5 million in additional funding for the substance abuse prevention to responding to the coronavirus. And again, we need legislative authority or LAC approval for that. And then finally, the mental health block grant is we've received $25 million in additional funding, for which again, we need legislative approval to spend. So the next slide, the remainder of my discussion is basically to go through some details that we know of about the federal funds that we've received. The CCDBG dollars are available until, and the potential uses, again, this is all tied to the responding to the COVID-19 pandemic, but potential uses include helping providers remain open or reopen, supporting the stability of the childcare sector, the childcare industry, providing childcare assistance to, including to healthcare workers and emergency responders, and then relief from co-payments and tuition payments for families. So these are allowable uses of the funds. department is still working on working with our partners to determine how best to use these dollars. And I think this is something we would certainly be transparent with the legislature on what our thoughts are, and would want to work with you and if these dollars get used. Within 60 days of enactment of the federal law, we need to have a report to the Office of Child Care and on the federal level describing how we intend to use the funds. So we are working to come up with a plan, and we'll certainly keep you abreast of that plan as we move forward. The second I wanted to talk about, one is the Chaffey Foster Care Program for Successful Transition to Adulthood. This makes a number of changes to that program to make it more expansive. It expands eligibility through age 26. It includes a moratorium on aging out of foster. It requires states to permit a child who left foster care due to aging out during the pandemic to re-enter foster care. It removes the 30% cap on room and board and expands provisions of these services. It allows funds to be used to provide driving and transportation services. And it increases the maximum annual award for training and post-secondary education for foster students from $5,000 to $12,000. The state did receive additional funding for concrete meals and home delivered meals. We don't have a lot of details about that at this point. This is pretty straightforward funding in terms of it. I think it comes down to how we plan to use it and if we plan to target it. But this is something we would deal with through the LAC process, working with the legislature. In terms of our behavioral health funding, the Substance Abuse Prevention and Treatment Block Grant includes targeted funding for pregnant women. It's targeted specifically to pregnant women, women with dependent children, and intravenous drug users. The funding can be used to provide tuberculosis services, early intervention services for HIV/AIDS, and primary prevention services. It generally funds priority treatment and support services for individuals without insurance. The mental health block grant, for which we received about $25 million, targets populations including adults with serious mental illness and children with serious emotional disturbance. This funds a priority of treatment support services for individuals without insurance again. The next steps, again, like I said, we haven't received the COVID funding yet, and we still haven't gotten notice of what our awards will be. These numbers are still preliminary. We'll be developing plans for using the funds and consulting with the legislature through the LAC process, and also through discussions about what plans how we plan to use the Child Care Development Block Grant funds. So as you can see, we don't have a lot of information yet, but as we gather more, we'll certainly keep you posted on that. Does anybody have any questions?
Well, thank you, Mr. Greenman, and I've got a bunch, but I'll yield to members first, just so I don't monopolize things. So any members with questions about any of these pages we've discussed? Senator Hoffman, are you waving your hand?
I am, Mr. Chair. Thank you. Mr. Greenman, I thank you very much. I mean, you raise a couple of points that came up when Senator Abeler and the rest of us were trying to do some retention dollars, right? We kept hearing from the department, we need statutory authority. And I know when you see one Medicaid plan in one state, you've seen one Medicaid plan in one state, right? But it just dawned on me, as you were mentioning 3 different times and 3 different proposals within what you're talking, that you needed statutory authority. And when you look at other states, when we had done looking at the 36 states that got retention dollars, a majority of them didn't have to get legislative authority. So is there something within our own statutory guidelines that are doing this, or is this something that's beyond? Because and will that slow up the process for you to get going with what you needed to get going on those 3 points? Thank you.
Mr. Greenman.
Thank you, Senator Hoffman and Chair Abeler. I think that's a really good question. In terms of, first of all, the difference between Minnesota and other states, without directly addressing the retention grants issue, I do recall that issue coming up and there being some frustration with that. I think Minnesota, in some ways, our laws are around setting rates and payments for providers appears in our statutes more often, is dictated in statute more often than other states tend to have theirs. That's at least what I've been told. That's what I understand. And so that may have some bearing on our ability to do some of the kinds of grants like the retention grants. But I'd probably want to think a little more about that one. In terms, I think you're on mute. Okay. The second question, slowing us down. I don't think it's going to slow us down. We're going to try to put, in terms of getting legislative approval to spend the money, we're going to put it in the federal funds table that gets released with the governor's budget on January 26th. And that will start the 20-day clock during which if nobody objects to us spending the money, we'll have the authority to spend it 20 days after that budget is released.
Okay, and I've just been, thank you, Mr. Greenman. We're going to actually put this topic aside a moment. I'm told that Ms. Bailey has to go at 2, and we don't want to lose her content. So we're actually going to move to the next agenda item. And actually, this gives me a chance to, I think we should play a little Zoom game here, and maybe we could vote, but I'm just going to start the game off. I think we're going to who's got the best background. We're not going to do the worst background, although we could do that as maybe just privately, but I just want to, Ms. Bailey, you have the happiest background of anybody today. So thank you for having that. So you win the first prize in the Human Services Committee in the Senate for the happiest background. So you can just start into your presentation if you like. And so we're looking into childcare and how much we've gotten, how much might have gone, and so on. So it's all yours. So thank you.
Mr. Chair, thank you very much. I thought it would be very befitting to have this conversation with you in my 3-year-old's bedroom. So that's my background. So thank you very much, Mr. Chair.
That's amazing.
I'm here to speak some COVID painting. I'm here to speak about the Education and Childcare COVID-19 Response Work Group. This work, I serve as the co-lead of this work group and as the Assistant Commissioner of the Governor's Children's Cabinet, and then in this particular role in the COVID response. The goal of this work group is to ensure that the care of children does not inhibit critical workers from reporting to work and to enable continuity of education through distance learning, beginning with early education and care. So the group was really set up to convene the cross-agency sector in this specific education and childcare work in response and ensure that we had coordinated strategies and clear communication and guidance across these various sectors to help support families. I want to start with a huge thank you to many of the leaders on this committee who have helped inform our work, taken many late night and weekend phone calls from us as we developed strategies, and they themselves heard feedback from their providers. So thank you so much, members of the committee. And I really want to take a pause to just thank the heroes and partnership that we've had with childcare providers throughout this pandemic. This slide includes a quote from the governor from remarks in November. And I couldn't have said it better myself. These folks have been heroes on the front lines from the beginning, and we've known clearly that about a third of our healthcare workforce depends on childcare, and they have been a central piece of our response from the very beginning. And I truly cannot thank them enough. I'm going to provide just a quick overview of actions, and then we'll speak to the funding and financial specifics, which I know is what the committee is most interested in. Some quick deliverables and actions of the work group. We really early on in pandemic response built a central hub for cross-agency communication, responsiveness, and really warm handoffs across agencies. there is a website set up, mn.gov/childcare, where we provide links to all of the relevant guidance related to childcare providers. When the pandemic first hit, when COVID first reached Minnesota, the state issued public health guidance for providers before the federal government, and then the federal government sort of caught up with us, and so we pulled ours down and pointed straight to them. But pieces like that were really sort of confusing for our childcare providers, we wanted to create one central place that they could go across the enterprise with the relevant information. We also set up public health calls. We began sending out weekly or biweekly provider update emails, and really looking for ways to just directly respond to the emergency needs that they had. There were periods, which I'll speak to around supplies in a few minutes, where we heard from providers, I can't stay open because I can't get milk, or I don't have hand sanitizer. And so we've really had kind of some iterations of emergency needs, and we've been able to work across partnerships in the public and private sector and engage our schools and others to respond. I'd also just highlight the financial supports that have been available to providers as businesses has been confusing at times for providers. And so we've developed financial supports matrix and engaged the federal government too in providing specific support around those things that are small businesses that also apply to childcare, as well as the specific childcare partnerships. And then we've really, with close partnership with MDH, been able to identify where there are hotspots or outbreaks and try to partner with external organizations and nonprofits that might have better relationships with those providers in some cases to be able to sort of respond to those hotspots and help support them. This is a map to your right that we built, and we update this weekly, of providers that are open. So anytime a family needed care. So early in the pandemic, providers may have closed temporarily and families were struggling to identify. Our strategy all along was, how do we build up and support the existing industry rather than try to create a new emergency industry that then would sort of undermine our an industry that was already struggling and vulnerable. So how do we leverage those providers who wanted to stay open? And it was quite fluid, which I'll talk about in a minute here. But this map was a way for us to create a very easy portal for families to be able to get information about who is open and connect folks with resources. We worked over the summer then to include youth programs and others. And as we entered fall and schools may have announced distance or hybrid learning, additional care resources there. And then, you know, on this website, there's also a families tab that provides a family resource guide and information across state systems. So while families may be interested in resources on food security or mental health, how do we create kind of one document and center point? And I would just highlight that for members of the committee here, that as you get questions from constituents on various resources, this is something that we really attempt to keep updated with our agency partners across the entire enterprise. Specifically on supply chain needs, I mentioned this. We know that to date, about 57% of our childcare centers, family childcare providers, have received supplies from the state. This includes thermometers, masks, gloves, hand sanitizer, bleach. We've been working with a subgroup that is chaired by some leaders, and you'll hear from Cindy Yang shortly, I think, on her team, to really be responsive and help support those needs, and with the critical care supplies work group here at the state. It's included a lot of donations as well, and trying to really respond, utilizing local emergency operation centers, and some really important partnerships with with some folks externally too. I just highlight Cub Foods stepped up in some really incredible ways, Du Nord donating, and we were able to partner in some really innovative ways to get to match that need with donations. And then we've really prioritized testing, knowing that that's a need throughout the pandemic. So we've done sort of a variety of iterations. In the fall, every childcare provider received a test code for a free mail test. This was prior to that program being launched statewide. We've created special prioritization in the testing sites and tried to be responsive in that way as well. In terms of financial support specifically, Minnesota has leveraged federal and state resources to support the industry and families needing care, like increased school-age care access for lower-income families and administrative flexibilities to support providers and care access. The financial support providers have received from these resources include $30 million in legislative allocation, and a huge thanks to you all who worked on that support earlier this year or last year, plus $10 million in CARES Act from the Child Care Development Block Grant funds. This was for the peacetime emergency childcare grants. This was a competitive process funded or focused on the critical sector access during the stay-at-home period. More than 3,100 programs received funding during one or more rounds of this grant. Next was the COVID-19 Public Health Supports Funds, and these were provided from July through December. They were funded through the Federal Coronavirus Relief Funds. There were 2 proposals passed through the LAC, a round from July to September, and then another round from October to December. This was $56.6 million and $53.3 million, respectively, in those 2 rounds. This was a non-competitive process, so providers were eligible. Any provider that applied and was eligible received those funds. The CARES Act CCDBG funds included Federal CARES Act included $3.5 billion in CCDBG increase to $1 million. The administration prioritized these funds to add that additional $10 million that I mentioned before to the final round of the peacetime emergency grants in June. An additional $1.4 million was also used for these grants to eligible providers that were affected by a grant application processing error in round 1 of April 2020. The legislature passed and the governor signed into law an increase to the Child Care Assistance Program provider reimbursement rates to achieve minimal compliance. This was $20.5 million. We allowed for child care assistance, family and provider flexibilities, which was $4.9 million. Support for family, friend, and neighbor care providers, which was up to $1 million. And then funds increased hours for school-age care accessing child care assistance when in distance and hybrid learning, which was $6.4 million. The state also used approximately $225,000 in child care and development block grant balance to help procure and distribute critical care supplies. For context, a national report by the Committee for Economic Development in 2009 using 2016 data estimated the child care industry total revenue in Minnesota to be $1.052 billion. Data on providers reached and the impact for each program included the following. The peacetime emergency grants I mentioned, more than 3,100 programs received that funding during one or more rounds. That includes 2,594 family childcare programs, 581 licensed childcare centers, and 11 certified centers. In terms of the COVID-19 Public Health Supports Funds, 7,044 programs received payments from July to September, including 5,797 family childcare providers, 1,167 licensed childcare centers, and 84 certified centers. Only nonprofit certified centers were eligible in July and August for the summer school-age care. 8,364 received payments October to December period, including 6,316 licensed family childcare providers, 1,536 licensed childcare centers, and 512 certified centers. Financial supports provided were per month and based on available research and community feedback. And again, that very much included many legislators on this committee, so a huge thank you. It included licensed family childcare providers receiving $1,200 per month, licensed centers receiving $8,500 per month, and nonprofit certified centers receiving $8,500 in July and August, and nonprofit and government certified centers receiving $3,000 per month in October and November. In December, licensed providers received a reduced amount. This was due to limited funding in the CRF and a high demand from providers. Again, I want to emphasize the success of this program has depended on open lines of communication and feedback loops with legislative leaders, childcare providers, and available state and federal research. In the bucket of huge gratitude for the private sector, I also want to mention that the Minnesota Initiative Foundations, Think Small, and other external partners have stepped up beginning immediately in March to help raise and commit dollars to support childcare providers early in the pandemic response. While a critical sector for emergency response, the industry faces significant ongoing increased needs, given the requirements needed to safely provide childcare in the midst of a pandemic that are not able to be met without support. Childcare businesses operated on a small margin before the pandemic. Challenges with cost and revenue only increased for providers. You've heard some about this already today and would defer to providers themselves. This slide shares a high-level summary of ongoing business challenges associated with the pandemic related to program changes and research we have used to better understand the impact of these costs, including research that shows a 47% increase in operating costs during the pandemic. I'm going to share a little bit of data available on the current status of childcare in Minnesota, starting with the operating status of licensed programs. The percentage of family childcare and center childcare licenses operating dropped at the beginning of the pandemic, but has returned to nearly 100%. Capacity is needed as many programs are running with smaller group sizes and other changes. And as this committee has addressed for many years, we have experienced a shortage of childcare long before COVID. The visual shows estimates of operating status by licensed family childcare on the left side of the screen and licensed centers on the right side. The purple bar chart are from licensing operating data in April 2019. The green bar shows are from providers who responded to COVID-19 public health supports for July through September. I'm going to share data on the DHS licensing on trends in licensure closure in 2019 and 2020. I will go through the graphs quickly, but in summary, this is what you'll see in the data. Both openings and closing have slowed for family childcare and center licenses during the pandemic compared to the same months in 2019. A net decrease of family childcare has been lower in the first 11 months of 2020 compared to the first 11 months of 2019. No impact is demonstrated on the proportion of family childcare licenses opened and closed in the metro versus greater Minnesota. Licensed childcare providers have seen almost the similar net change in 2020 versus 2019. In the next slide, the graph shows childcare licenses closed for calendar years 2019 to 2020. These are permanent license closures as reported to DHS licensing. The next graph shows family childcare licenses closed for calendar years 2019 and 2020. In nearly all months during the pandemic, you see that more licenses were closed in 2019 compared to 2020. This is a graph showing the percentages of closed childcare facilities by state. And I would say this is something that we're tracking closely and really proud of based on the responses to a questionnaire and interviews in April 2020. State agencies reported that about 63% of childcare centers and 27% of family childcare providers had closed during COVID-19. 8 states reported that more than 75% of their facilities had closed, and 20 other states reported between 50 and 75 facilities had closed. We consider this data to show our strategies have worked and helped to stabilize the market. We continue to look for updated data. Lastly, I just mentioned briefly, we continue to leverage research and data available that includes very much engagement from all of you. Looking toward the work in 2021 and beyond, current activities of the work group is navigating include short-term and long-term strategies of new federal funding, vaccine prioritization and implementation, continued ongoing engagement with providers, financial supports and resources, including supplies and quick analyzing, continuing to receive feedback, routine and regular access to testing. We've launched a screening testing program in programs that were invited to, all programs were invited to participate. 140 programs and many Head Start programs across the state are currently participating in that on-site screening testing. And then emergency care needs, matching emergency workers with childcare options. I'm really proud of our partners across agencies and the many hours of hard work. Mr. Chair, I know Cindy Yang is prepared to continue the presentation on funding details, but I'll turn it back over to you. Thank you.
Well, and thank you. And that's actually more information than I even thought we'd be getting. So I think that's a very helpful. You have some master students writing on the status of childcare in Minnesota. Hey kids, here's your paper right here. So just that's a courtesy of the department. It's actually very comprehensive, and people that are really interested in this, if they read this over, they'll get quite a good state of update about what we've got. Plus, as we also mentioned, the background award winner, written by that person. So that's something else to brag about. So I know you have to go, so I'll just comment about a little bit. So there's about $1 billion, 1.05 billion in total childcare revenue in Minnesota. And maybe Ms. Yang can just finish up, but I'm curious how much money we've dispensed above and beyond the regular CCAP money into the system. If somebody can just tell me that before we leave today. And then CCAP was estimated to be at a couple $100 million, I think, for the year, something like that. And how much have we under spent on that because people were closed. So I don't know how you want to handle that question, Ms. Bailey. If you have to go, I'm going to let you go and let you pick up the.
Mr. Chair, I would defer to Cindy Yang or Dave Greenman on that question anyway, but I can stay for a few more minutes if there are other questions.
Okay, well, questions from members, let's do that while Ms. Bailey is still here. Let's see, hands. Maybe Ms. Bailey, you want to, oh yeah, no, they're just popping up. Senator Housley, welcome to this might be your first hand on the committee. That's another award-winning thing. And you have a pretty good background too, Senator, so. But I'm sorry, it wasn't the winner. It wasn't the winner, but no, you're number 2 probably for today.
No, I just want to thank Ms. Bailey. Senator Franson and I and Ms. Bailey worked hard on those child care grants, and it was a pleasure to work with you. And this is a lot of data. I had my LA Go printed out, so I kind of have to absorb it all. This is a ton. So maybe, Mr. Chair, we can have her back sometime in the future once I absorb it all. But thank you very much. And it was a pleasure to work with you to help out all of those family child care providers and our in-home centers. So thank you.
Super. Well, thank you. And yeah, it's good information. Senator Wickland and Senator Franson.
Thank you. Thanks, Mr. Chair. Yeah, thank you to all of the people who have worked on the childcare working group and others over this past year. It's just been incredible, the amount of effort that's gone into it. My question is, I guess, we're still seeing that we need more providers to increase capacity. We don't have enough providers. Have you thought about any ways, I don't know, short term, that we could provide incentives for some of those that have closed to reopen, to make it easier, or just due to the capacity requirements that we're facing right now per provider? Are there ways that we could incent more providers to come back? Thanks.
Ms. Bailey.
Yeah, Mr. Chair and Senator Wickland, yes, very much. And I think we would very much be interested in continuing that conversation with you and providers. I think Cindy will speak to some of the future plans around additional resources from the federal government in partnership with all of you. And I think we are really laser focused on that engagement and understanding what's the best way. I think what we've learned in pandemic response is there's no secret sauce or no playbook for this. So we really have to depend on partnership and learnings across the state. I think there are lots of ideas around some incentives on bringing folks back online and a lot of priorities. So I think we would love to continue that conversation with all of you. I would also say that as we've seen I didn't cover this in this presentation, but did in another committee, that we really see financial impact follow cases. So when a program or classroom is closed and quarantined, we see pretty significant impacts financially to that program. And so I think as we follow those trends, we also know we have some specific kind of immediate needs continuing to support keeping existing providers open as well.
And Ms. Bailey, we'll go back to Senator Wickland in a second. It sounds like you said 99% of the providers or something are open. Do you know what the general capacity is at? Are we at 60% statewide or something like that? Or do you know offhand of slots?
Mr. Chair, I think I would feel comfortable looping back with you on that. I think we are at, I think we are far higher than 60. But I don't feel comfortable answering it I'll get back to you with the specific detail. I think we're more or less tracking with where we were the previous year. I mean, I think as I shared on the graphs, we are in a better spot in some ways than as compared to previous year in terms of the programs being open, but I can't speak to the exact slots.
Oh, that's fine. Senator Wickland, did you want to follow up?
No, that's all. Thanks.
Okay, Senator Franson.
Thank you, Mr. Chair, and thank you, Ms. Bailey, for all your efforts and all the staff that was involved. I echo Senator Housley's and Senator Halverson's thanks, because there was really a lot of things happening behind the scenes. And Minnesota was one of the few states, if not only states, that early on in the pandemic injected resources from our general fund to make sure that we had the capacity and support our providers. And that's really paid off compared to other states that we've seen have some gaps still today. So thank you for those efforts. I know that the next round of funding coming from December 27th from Mr. Greenman sounds like we don't need enabling legislation to spend it, but I do want to acknowledge that we've had some learnings since the first funding rounds that we made at the state level, and that there might be some room for adjustments and flexibility, which we at least get some insight on what those would look like moving forward, maybe now, if not now, maybe later. So we understand how those funds are going to be dispersed, because I know we had bigger money for bigger centers, but some centers might not necessarily need that big amount, and maybe we need to be a little bit more nimble and flexible. So just wanted to at least have the transparency of the decisions being made and give some input from our vantage point. That would be helpful, I think, for committee members. And second, as well, is maybe after the fact, or maybe during this next round, also starting to gauge and survey. And I know you've done some of that already through your associations, but who are the ones that are closing and why and where, and what can we do differently potentially with this next round of federal funding?
Well, thank you. Was that a question, or is that just something a comment kind of?
It's both. It's both a question that I hope that we are able, Mr. Chair, to adjust what we're doing, because we were doing a lot of decision making with little information, and now we've had some months of experience and insight from a lot of the members of these associations that represent these providers, small, big, and everything in between. And we know we have different models across the state, so we want to make sure we're not leaving anyone behind, and the communities that really struggle with finding affordable childcare can still find that with this next round, that maybe we target them in a different way. So those are just my comments, but also, since we don't need to tell you how to spend the money, we still want to tell you how to spend the money.
Well, and thanks, Senator Franz and Amon. So I take it a couple different ways, and all positive. Childcare is a significant component of this committee, and this is we just dabbled in some numbers already. But so for members who are interested in digging a little deeper into childcare, I'm looking for volunteers. I'd like to have at least one from each side who want to dig in on some of this. And Ms. Bailey, you hear the comments, and I know you have to go, so I think we'll bring this in for a landing. But the work group is pretty much administration folks, and then you were talking to some people, and however deep that information sinks into the product, I don't know. But I know this committee of 9 that's in front of you is keenly interested, and actually has feelers into a big part of the state, and the members who aren't here are also interested. And so if I can offer you a learning that I've experienced since March, we're here to help too. And so the department sets a direction, and I think in a thoughtful way, we temper that sometimes and help to shift the focus. And I think Senator Franson is saying that as well. And you certainly want to include her of anybody, but some of the rest of us want to be a part of that too. So particularly, we'll get into the next segment about going back to the new money coming. I think we definitely need to be part of that, not just one or two random legislators. So Ms. Bailey, why don't you react to that, and then we'll let you head off to where you're.
Yeah, Mr. Chair and Senator Franzen, I couldn't agree with you more, and would love to have further conversations about the best way to do that. I have worked with many legislators who are willing to pick up the phone and call their grocery store to help providers respond. I think the way that partnership has looked has frankly been incredible across both aisles and both chambers. And I can't thank you all for that enough. And I think the only reason why we're in this position is really due to that partnership. And frankly, Ms. Yang's going to speak to the future funding and those pieces. I think we have some plans for that immediate short-term piece, but the next month, but we really, really, really want that additional feedback. So would love, direction from you on the best way to engage and do that. And again, a huge thank you. And as I turn it over I have to run actually and talk about the vaccine pilot that we're doing to prioritize childcare providers in that on the press call. But I just really, as I turn it over back to you, Mr. Chair, and to Ms. Yang, just want to say a huge thanks to my colleagues at DHS and the 5 other agencies that are on this. I mean, people are working round the clock in new, creative, innovative ways to solve problems, and we genuinely want to partner with you in meaningful ways. So help us figure out the best way to engage and continue those conversations. And just a huge thank you for your interest and work together. And I echo Senator Housley's comments. I think her and Senator Franzen and Senator Benson, we've had some just incredible conversations over the last, and Senator Wickland, last several months, and just a huge thanks for that.
Well, thanks. And Ms. Bailey, thanks for being here. Just I have one, just to summarize my request going out of here. What I was looking for was kind of a math discussion. We actually got a much more deep discussion into the policy and the status, which I think was excellent. So thanks for that. But just as if there could be like a little bit, so there's $1.052 billion, 0.05 in money in the childcare world. It sounds like $750 million would have been contributed by private money, and $250 million or so usually comes from us. We've dumped in $1/3 billion or something. I'm curious just the status of how much they've lost, even counting that. If there's some way to estimate, that's kind of what my just big question, just so we can know. And
yeah, Mr. Chair, I think we have research. Oh, sorry.
Yeah, no, go ahead. You can talk.
Yeah, Mr. Chair, I think we have research we could share with you, and I think there are some external experts that I would want to include and point you to as well. And maybe Mr. Greenman and Ms. Yang can speak to some of these pieces as well.
Well, and then for later, I think I don't know that you have it right now, so we can get it out to the committee. It's just helpful as a finance committee just to know, what did we accomplish? Are they 80% whole with the money, and that's not too bad? Are they 2/3 whole? That sounds like that's a lot. They lost 1/3. Anyway, thank you. We're gonna go talk to the press. You got a press. Yeah, there you go. Ms. Yang, let's go through your content, and then we'll come back and bring Mr. Greenman and whoever's left to ask questions. That'll keep us on track, I think. This has been a very productive meeting so far. So Ms. Yang, welcome. That's whenever you can go, it's fine.
Mr. Chair, can you hear me?
I can now, yeah, please.
Okay. Sorry, my headphones are not working. Good afternoon.
That's a really
Mr. Chair,
bad feeling when you're trying to present and you're like up. So welcome.
Thank you, Mr. Chair and members of the committee. I am Cindy Yang, Director of Child Care Services Division at the Department of Human Services. Thank you for inviting me to testify today on the new federal COVID-19 relief funds for childcare. Mr. Greenman earlier had noticed some of the information already, but I'll share a little bit more of the details. And so in regards to the overview of the new federal COVID-19 relief bill, again, the funds for coronavirus relief were included in the Consolidated Appropriations Act of 2021, which was signed into law by the President on December 27th of 2020. And so the bill includes $10 billion for childcare, which is made available to states through the Child Care Development Block Grant. We have not received the final, the official award letter yet. However, as Mr. Greenman had stated earlier, we expect for Minnesota to receive an estimated $137 million in additional funds. And so I do want to highlight a few important key dates here. So by approximately around February 25th, we must submit a report to the U.S. Office of Child Care describing how DHS intends to use these funds. By September 30th, DHS will, by September 30th, 2022, DHS will be required to have obligated these funds. By October 31st of 2022, DHS must submit a report to the Office of Child Care describing how the funds appropriated under this this act are committed to be spent. By September 30th of 2023, that is when all funds must be spent. The law does provide flexible funding. Mr. Greenman had shared some of those flexible funding, and so you do have that information in the handouts. The new funds must be used to for purposes related to COVID-19 response and can be used for expenses incurred prior to the enactment of this new law. Ms. Bailey had mentioned some of our short-term strategies earlier in her presentation, so I do want to highlight a couple of short-term plans in how we are going to be using the funds. So one way in which we will be using the funds is to reduce or temporarily fund CCAP, the Child Care Assistance Program, specifically the basic sliding fee wait list. We intend to use the existing statutory authorities and infuse $15 million to serve up to 780 new families, balancing the funds over 2 calendar years. So calendar year 21 and then also calendar year 22. So 10 million will be added to calendar year 21, whereas 5 million will be added to calendar year 22. Counties and tribes will have revised calendar year 21 allocations, which will be posted soon. This supports essential workers. It is estimated that roughly about 82% of families who are eligible for the Child Care Assistance Program work in critical sectors. So for the BSF, the basic sliding fee, what we're planning to do is align with a bill in December that was proposed in December 2020, but ensuring that we can get funding out quickly through administrative action, which does not allow us to reprioritize the wait list. So we will continue to work with counties and legislators on the BSF issues. Then also additionally, the projected CCAP spending versus the actual CCAP spending, I do just want to highlight a couple of points here. For the basic sliding fee, projections are based on a calendar year. So the calendar year 2020 is not final. As of November 2020, local agencies were expected to spend approximately 99 million of the 108 million allocated for BSF. For MFIP childcare, projections are tracked on a state fiscal year. So as of November 2020, 46 million of the forecasted 164.7 million amount was spent. The second approach that we are intending to take in how to spend the new dollars is to continue the successful COVID-19 public health support funds for childcare programs. So for the months of January and February, which we're anticipating an estimated cost of 45 million for those 2 additional months. So DHS must move quickly to use these new federal COVID relief funds to continue these payments. Requirements to operate at a lower ratio and group sizes with substantially lower profit margins continue to put the industry at risk. So the payments that DHS has made to childcare programs from July to December, as you've heard Ms. Bailey mention earlier, has helped stabilize the childcare market. So as a result, Minnesota has not experienced major losses of childcare programs during the pandemic, especially compared to other states, whereas as many as half of the providers have closed. And so in addition to these short-term uses, DHS is in collaboration with the Education and Childcare Work Group that Ms. Bailey co-chairs. So we'll be working with our other state partners, the Children's Cabinet, and then we intend to rapidly identify strategies for use of the remaining funds for longer-term public health supports for childcare providers. And so we look forward to conferring with you all, members of the legislature, as well as other stakeholders in the upcoming weeks here. With that, Mr. Chair, I conclude my formal presentation here.
Well, thank you. I appreciate that. So just if I do my quick math here, I think there's some $60 million left, maybe 62 or something, that you've committed 75 million to these proposals. Is that right, Ms. Yang, about?
Yes, so our estimated allocation is 137 million, and so 45 million of that will go to the COVID-19 public health support funds to continue to extend that support program for an additional 2 months, and then we will be infusing 15 million into the basic sliding fee.
But also 10 and then 15 million in the future. So that's right. That's part of this pot too.
Mr.
Money.
Chair, the basic sliding fee is a total of 15 million.
Oh, I see. I misunderstood. We're going to take a little discussion about this. So members on this committee who are interested in feeding into Ms. Yang and Ms. Bailey and her group, I think it's a good idea to do that pretty quick. I'm disappointed that the feds gave us only 60 days to spend, $1/6 of $1 billion. We could have maybe targeted that a little more carefully. I hope when my input is this on that, that at the end, if there's something that we could have to show for this, where we've improved how many places there are, helping. It sounds like you can't help new settings open, but it seems like we have needs where we're trying to get more settings in greater Minnesota around workplaces, and in fact, we've lost a bunch. So is there some ability to do that, to try to improve the whole system, or are these merely kind of patches to keep people open? Ms. Yang.
Mr. Chair, thank you for the question. I think as we have identified these two short-term approach, again, these are short-term approach in taking into consideration what we have heard from providers, from stakeholders, from different legislators in the past. And so these are two short-term approaches that we had determined would be helpful for now. But as I had stated earlier, as long as long-term strategies, I think that's a important factor to consider. And so we certainly welcome the continued feedback in order to inform the long-term strategies.
Yeah, because you only have a month. I mean, it's too bad we didn't have like 2 months to talk about it and have a hearing, or go to a work group of a whole bunch of people. That's oftentimes more public than what happens when a group of administrators sit down. So I'll just offer you a suggestion publicly, and then we'll all talk about some more things. But we've had a lot of luck with some innovation grants in the disability sector. And so maybe if you put, $20 million into cool grants where people would think of something interesting, just to kind of partition it out, you might have something really to show, and for that when this all settles. And I just also want to caution you about spending money on things that we're not going to be able to continue. On the sliding fee, that's going to take care of 780 families for a year, or how long is that going to last? Just on that front end question.
Mr. Chair, thank you for the question and for your feedback in the comments. As far as the basic sliding fee, we are intending for the to be able to serve up to roughly about 780 families over the 2 calendar years, so 2021 and 2022.
All right, and I'm happy to hear that. So there's not a cliff, So let me go to questions from people. Senator Halsey, are you trying to speak up there?
Yeah. To that, thank you, Mr. Chair. To that point for Ms. Yang, what happens to those families once the additional funding for the basic sliding fee is gone? What will happen to those 780 families?
Ms. Yang.
Mr. Chair, that's a great question. I do have one of my managers also listening here, and so she'll be able to provide some more specific technical support and details here. So if I can hand it over to Ms. Poseen, that would be great.
Thanks.
Good afternoon. Yeah, good afternoon, Mr. Chair,
Welcome.
members of the committee. Great question. The way the BSF funds are managed, in short, we predict take-up rates and we predict attrition. But when the monies are infused, they are not tied to a family. So in short, families don't lose out if the money is managed as a whole. Families are not allowed to be kicked off the program ever unless an allocation is cut mid-year, which has only happened once in the 20-some years I've been involved in this. So by statute, families are protected, and we work with existing statute and rules to make sure that monies stay available to the families that have them.
Senator Housley.
Thank you.
Mm-hmm.
And so, Ms. Pacine, if we add 780 families, and actually they're gonna filter through, they'll come and go, be a different probably cluster of families. But so, if we run out of money at some point, they can't be kicked off. Does that become a general fund forecast liability, or how do you handle a shortfall?
No, counties would handle shortfalls. Really, the allocation management, because of the law and the way it works, the allocation management falls to the counties, which is sometimes why we see statewide underspending, because counties understandably are risk averse to that happening.
So they would see that their money is running dry. They would enroll fewer families a year and a half from now. Okay.
Correct.
Senator Benson.
Mr. Chair, at one point in the conversation about basic sliding fee, there was some general fund money. Could you tell me, maybe Ms. Yang could tell me if there's any general fund money in the current 15 million, 10 million in 2021, and 5 million in 2022?
Whichever of you, please.
Thank you.
Ms. Pacine.
Thank you for the question. Yes, this is Lori again, Lori Pacine again, the manager for CCAP. No, there are no general funds tied to this. This infusion is all federal. The reason there was general fund tied to the legislative version, the bills that were talked about during some special sessions, was that because there was reprioritization, of TY, transition year extension families, which gets into a whole kind of technical conversation about how priorities and monies work together. But in short, TYE does not need to be factored in with a non-legislative approach. And so no state monies are needed for this use.
So Ms. Pacine, just to be clear, and then I'll go back to Senator Benson. So in everything that we talked about looking forward of this, whatever we're calling this CARES 2, that's not it, but whatever we call it, there's no general fund in any of your proposal. It's all money that comes out of this 137 million or whatever other monies are coming forward. That's what you said, right?
I'm sorry, Mr. Chair and others. I'm only answering about the CCAP items. And so as a whole, I believe that to be true to the whole grant, but or at least of the two things that we've committed, but I
that's fine.
Yeah,
Senator
I believe.
Benson, and we'll have Mr. Greenman answer after you ask your question.
Okay.
Senator Benson, go ahead.
And Mr. Chair, what tends to happen is federal money comes in, and this is one of the things that I watch for on federal grant review. Federal money comes in, there might be FTEs added, there might be a maintenance of effort added. Don't have a chance to look at anything here, so I just want to be sure there's no MOE tied to this. We are setting an expectation for the population that there will be an expansion of basic sliding fee, and so there will be people coming to ask for general fund backfill, but can I get clarification? There's no maintenance of effort requirement associated with this money.
Ms. Pacine or Mr. Greenman, whichever, Ms. Yang, somebody. Who knows that? Ms. Sommerfeld, wow.
Good morning.
Welcome.
Good afternoon.
Popping up on the screen. Welcome to the committee. We haven't seen you yet this year. Welcome to you.
You have not. So count yourself lucky. So, Mr. Chair, members of the committee, I believe that all of the money that's going into this is federal. I will confirm that with some of our staff afterwards, but yes, at this point, it's all federal, and we don't anticipate hiring FTEs or doing anything of that nature.
Okay.
And Mr. Chair, just to clarify, no maintenance of effort requirement.
Ms. Sommerfeld.
I don't believe I would actually need Dave Greenman to confirm that, but he's not on the call. But my understanding, as much as I understand maintenance of effort, is that no, there will be no additional cost.
Mr. Greenman, welcome back to the committee.
I am here. Yes, this is Dave Greenman with the Department of Human Services. My understanding is there is no maintenance of effort, but I will double check to make sure that that's correct. And if it's not, I'll let you know.
Okay, thank you.
Thank you. Senator Benson, that's all you have.
That's all.
Okay, I have just a couple more questions. So on these other topics, and we may have to come back. I mean, we're a little over time now, but this is, I think, really important. It's the first exposure we've had to this, and I'm sure finance will be interested in hearing from you all. But on these other ones, the substance abuse, mental health, the meals, Chaffey foster care, do those also need to plan in 5 weeks or so, or are those more open-ended? Ms. Yang.
Mr. Chair, for the Child Care Development Block Grant, it does not. I'm not sure what the timeline is for those other funding sources, but the two short-term approaches that I had mentioned here around the basic sliding fee and the public health support funds is specific to the Child Care Development Block Grant.
Okay. Does anybody know what the deadline is to spend? We have a long time to spend it, but on these other topic areas, is there time to have a process and take public input and listen to us on those things, Mr. Greenman? I see you're
Chair, I think that the amount of time in which we have to spend those dollars probably varies by the different grants amounts. We'd have to find out what the deadline is for each of those. I think as we're doing more analysis, once we get the letters, the notices of award from the federal government on behalf of their agencies for those funds, we will be able to then tell how much time we have before we have to start spending those dollars. Sometimes they're fairly short. I don't know. I don't have any reason to think that these are going to be, things that we have to spend right away, like before the end of the calendar year. But I'd want to find out for sure.
Well, and we heard on the other stuff that you have like 60 days from passage to do the planning, and then you have 2 years to spend it or something. And so I think we're coming in for a landing here just out of respecting people's time. But, there's a whole group of people that are extremely concerned about mental health issues. And we're going to be fighting to keep the money we have in our budget. And if you have $25 million and we're just going to spend it on random things, I don't suppose we can supplant, but we have to supplement. But if we were going to buy something, we'd want to really have all those people engaged in that discussion, and even both bodies, House and Senate, and maybe agree on something. And the LAC plan system is a relatively poor one for feedback. If we don't want to do it, then you can do it a little later, whatever you want. So if you could find that out, that'd be great. And the substance abuse, and it's curious that they singled out tuberculosis, and maybe there's more of it around than I know, but I haven't heard the word tuberculosis in my earshot for a good long time. And so maybe that's important to somebody who thought that was a problem. And if we had $23 million in substance abuse, would we put it into those things? So those are the comments I have. And my final one, and then I'll open it up one more time for questions and then we'll be done. On the Chaffey foster care program, expanding eligibility and the moratorium and caps are removed for only $1 million. I'm interested in how long that's going to last and how, if they think we're going to have to pay for that when that expires. I don't know how long, if that's good for a year, 2, 5 years. And so, Mr. Greenman, I think I'll leave you off the hook on this because I think I'm beyond what you're able to answer right now. But I would love to hear back from you. I know the committee's interested. And if I have only one point, and I think it's been made in a bipartisan way, we are eager partners to partner with the administration to find the best ways to solve this. All my rhetoric you hear, Senator Hoffman, and all the rest of the committee members today has been, how can we do to help make this work better for all 5.4 Minnesotans and the 1.1 million Minnesotans who rely on something that we do, that you administrate, that we cooperatively help to devise. So any other questions from members? I don't want to cut you off. I don't see any hands. So this has been an extremely productive meeting, even better than I expected. So thanks to the department staff, thanks to congratulate Ms. Bailey as the winner of the Best Background Award, which I think we should just keep up doing. So members, be thoughtful about that as you choose your backgrounds. They could be virtual if you want to be on the space shuttle or something. But we have a lot of work ahead for us, and this is a really good start with the kind of tone that we've set with this. So thank you everybody who came, and with that, we're adjourned. Thank you very much.